morning. Thank you very much for inviting me to come share our interesting studies of host cell gene transcriptomics and their association with disease severity and primary RSV infection. Several host environmental factors are known to be associated with disease severity and RSV. Infants born prematurely, those with cardiac or pulmonary disease, are at increased risk for severe infection. However, less is known about disease severity and factors associated with disease severity in previously healthy full-term infants. The host immune response is believed to play an important role in influencing the outcome of infection, and CD4 T cells specifically are hypothesized to play a role in disease severity. Yet these factors in CD4 T cells are not yet well defined. In-depth interrogation of the CD4 T cell response in relationship to disease severity would be helpful in unraveling disease pathogenesis. In addition, the identification of biomarkers of severe disease would be helpful. Thank you very much. The ASPIRE study, which you heard about earlier today from Dave Topham, is a translational study that aims to determine a set of host, environmental, and viral factors associated with severity of primary RSV infection. The study collected a set of demographic and clinical variables. We also collected viral factors and looked at the upper respiratory colonization with pathogenic bacteria as well as other viruses. And we did CD4 T cell transcriptomics in association with disease severity. The study design was also briefly mentioned. Our goal was to enroll healthy full-term infants with primary RSV infection during their first winter season. In order to span the range of disease severity, we screened patients from 3 separate populations. The first was a group of infants enrolled prospectively at birth and followed through their first winter season. Parents identified when children had respiratory symptoms and notified us, even when these symptoms would not have otherwise come to medical attention. The second group was a group of infants with respiratory symptoms who presented to ambulatory settings, private practices, and clinics, as well as the ED. And the third group were hospitalized infants with RSV disease, both those in the general care ward and those in the ICU. This figure outlines our data and specimen collection protocol. Infants with documented RSV infection were seen for their first study visit at day 2 to 5 after the development of symptoms. They were then seen again at convalescence at approximately 2 weeks. Demographic and clinical variables that are known or hypothesized to be associated with disease severity were collected. We collected a nasal swab in order to confirm RSV infection and also to look for other potentially pathogenic bacteria or viral co-infections. We also collected 2 to 3 cc's of blood, isolated PBMCs, stained and sorted CD4 T cells within that first day, within a few hours of enrollment. This diagram outlines the distribution of our subjects based upon the 2 variables seen. On the x-axis is oxygen saturation level, and on the y-axis is the maximal respiratory rate, and the oxygen saturation level is the worst oxygen saturation level recorded for those infants. 23 subjects were identified at each end of the disease spectrum. Those in the severe group had respiratory rates greater than 65 breaths per minute and an oxygen saturation less than or equal to 88%. And in the mild phenotype, respiratory rates never went above 55 breaths per minute, and their saturations were equal to or greater than 97%. This table shows the clinical demographic variables of the mild and severe cohorts. In a univariate analysis, age in months was different between the groups, and it was approximately a 5-week difference. Gestational age was also significantly different, with the severe group having slightly younger gestational age. There was more breastfeeding in the mild group and more passive environmental tobacco smoke in the severe group. In the multivariate analysis, only gestational age remained significant. Prior studies have suggested that RSV type, viral co-infection, or the presence of pathogenic bacteria are associated with disease severity. We performed the same type of analysis as shown on the prior slide. We found that RSV group was equivalent between the mild and the severe group. The presence of other respiratory viruses was not significant in univariate or multivariate analysis. But the presence of strep pneumo or Haemophilus influenza in the airway at the time of RSV infection was significantly associated with disease severity, and this was a robust finding in both the univariate and the multivariate analysis. This figure highlights our transcriptomic analysis, which I'm now going to focus on. It shows our data collection and specimen processing, as well as data quality. We had a mapping rate of over 90%, and this was all done by RNA-seq, a mapping rate of over 90%. The final data analytic set included expression values for more than 10,000 genes and a gene detection rate of approximately 60%. This table summarizes the CD4 T-cell gene expression, differential gene expression associated with disease severity in our population. We use SAM-seq with a false discovery rate of 5% to look at rank variables like severity, and Benjamini-Hochberg with a p-value of 0.05 to assess correlations with disease severity and continuous variables. In univariate analysis, illness severity is the variable most highly associated with differential gene expression. The worst oxygen saturation during illness also had a significant impact on gene expression. In multivariate analysis, again, illness severity remained the factor with the greatest impact on differential gene expression. We then did pathway analysis to look for the gene sets associated with disease severity, and this figure shows the results of that analysis. Column A shows the significance of the pathways associated in our univariate analysis. Column B, pathways associated with worst oxygen saturation. And column C, pathways associated with our multivariate analysis. The darker the color red shows a greater statistical significance. Orange circles highlight pathways that show activation, and blue circles are pathways that show suppression. On the left, you can see there are 16 pathways outlined. These were all statistically significant in 2 or more of the analyses. On the right, the individual genes affected in each of these pathways, and these genes are color-coded. Red shows genes that have increased gene expression, and green, genes with decreased gene expression. The bolded genes are those that show a 1.5-fold or greater difference. I just wanted to highlight prolactin signaling as an interesting pathway to think about. This pathway was significantly associated with severity and showed activation. This is consistent with a previous report showing that infants with severe RSV disease had elevated circulating levels of prolactin. And you can see this doesn't appear to be associated with the degree of hypoxia. The other pathway I wanted to point out was IL-9 signaling. This is a significantly associated pathway with severity. And children with severe disease have been shown to have increased levels of IL-9 in their bronchial secretions. Mouse models have also shown IL-9 to be an important factor in models of RSV-enhanced disease. We then performed Bayesian estimation of transcription factor activity, and this was done with the CD4 gene sets associated with severity. We found that GATA3 activity was significantly associated with severity. GATA3 is an important transcription factor for Th2 cell differentiation and also in differentiation of Th9 cells. We believe these data support the interpretation that CD4 T cell subpopulation differentiation is important in disease severity and primary infection. This last slide looks at the pathways associated with stage of infection. Column A includes rank correlations with days since onset of illness. Column B is a multivariate model with days since onset of illness. Column C is a univariate analysis in children with mild disease with acute versus convalescent samples. And column D is univariate analysis, acute versus convalescent illness in children with severe disease. 10 pathways are outlined. Again, the orange circle shows activation of the pathway. On the right are the genes associated. You can see a consistent and strong association with interferon signaling and acute infection. And interferon regulatory factors were also significantly associated with these gene pathways. So in summary, gestational age, the presence of potentially pathogenic bacteria are associated with disease severity. We were able to successfully interrogate CD4 T cell specific transcriptomes in RSV infected infants during their first winter season. RNA expression changes in CD4 cells are associated with severe outcome and the timing of illness. And our data does suggest changes in CD4 T cell subpopulations are important in severity. And again, it takes many people to perform these studies. I'd like to thank everyone and thank you, and I'd be happy to answer any questions.
So what effect does you're doing positive selection with CD4, is that right, in your sorting stage?
Yes.
You'll have to speak close to the microphone.
Yes.
So does that have any effect on the RNA-seq pattern? Do you know what that selection process does to the expression?
No.
No.
It's done very quickly, so hopefully not much, but we're not aware of any changes.
Thank you very much. It was a very nice study.
Thank you.
I'm jealous that you can do the CD4 purify. We have always do with whole blood. So one striking feature when we look at the whole blood in our very consistent in all RSV studies that we see a tremendous underexpression of genes related to T cells, but we will not know if they were CD8s or CD4s. So when you look at the overall CD4 group of the 10,000 genes that you were able to identify consistently, they were all mostly overexpressed or activated, or they were more underexpressed or suppressed?
There were pathways that were suppressed as well, but there were more pathways that showed activation, but there were pathways that showed suppression.
And the way, if I understood the pathways, that I was very interested in the IL-9, the prolactin, I would never guess. You know, we think about maybe breastfeeding and prolactin and RSV, but never that was a relevant pathway. There were any pathways of the suppression of the CD4s that were correlated with any severity or disease severity?
There was a pathway that was suppressed associated with disease severity. I can't get it. And to be honest with you, off the top of my head, I can't remember which one it is.
It was interesting. Mostly you didn't see that the suppression was a major issue. Despite that, I mean, as I asked first to Dave, and that your patients were all very young, and they were very well matched for the outpatient and the inpatient. So that's very interesting.
Some of the pathways we did not have a directionality, we just knew they were altered. So the circles highlighted the pathways where there was clear activation or clear suppression.
So in the study, are you going to follow up through to later life to see whether these children turn into wheezers?
That would be an interesting study to do, but right now we're still thinking about how to follow these children out.
Do you speculate about how these might predict later outcome? these patterns that you see? Or
Sorry.
okay, great. Well, thank you very much indeed. Thank you.